Before start of about national population policy, we have to know about certain terms like population. Population is a summation of all the organisms of the same group or species which live in the same geographical area and have the capability of interbreeding. What do you mean by policy? Policy is a set of ideas or plan that is used on the basis for decision making. तो जब भी हम कोई पॉलिसी बनाते हैं किसी भी चीज़ से, लाइक जैसे रोड ट्रैफिक के लिए पॉलिसी है, या हमारे नीट एग्ज़ाम के लिए पॉलिसी है, या किसी भी ऑर्गेनाइजेशन की कोई भी पॉलिसी है, तो उसमें हम कोई भी आइडियाज़ होते हैं और कुछ प्लान्स होते हैं, उनके डिसीजन मेकिंग के अकॉर्डिंग वो पॉलिसी बनाते हैं. देन what do you mean by policy? Policy is a attitude and action of the organization regarding a particular issue and general statement of understanding which guide decision making. Population policy की need क्या है इंडिया में? तो what is the need of population policy? क्योंकि in 2000 population of India was about 1 billion. And it is 16% of world's population, and land area of India is 2.4% of all the world. And if current trends continue, India may overtake China by 2045 to become the most populous country in the world. And global population तो थ्रीफोल्ड इन ड्यूरिंग द 2 to 6 बिलियन जो ग्लोबली हम देख रहे हैं, तो ग्लोबली 2 to 6 बिलियन हमारा जो थ्रीफोल्ड इंक्रीज़ हो गया है पॉपुलेशन. देन पॉपुलेशन जो इंडिया की है वो नियरली 5 टाइम इंक्रीज़ हो रही है ड्यूरिंग द सेम पीरियड. सो दैट्स व्हाई देयर इज़ नीड ऑफ मेकिंग पॉपुलेशन पॉलिसी. यू कैन सी इन दिस ग्राफ. In 1950, population of India was around 30 billion. Now it is in increasing trend. You can see in it is increasing trend. तो now जो 2020 में यहाँ हमने देखा है कि इंडिया की जो पॉपुलेशन है it is around 130 billion. तो अकॉर्डिंग टू जो हम ग्राफ हम देख रहे हैं फ्रॉम 1950 से कि अपवर्ड ट्रेंड में है, तो अज्यूम कर रहे हैं कि 2045 में जो हमारा इंडिया की पॉपुलेशन है वो अराउंड 150 बिलियन हो जाएगी. एंड साइमल्टेनियसली देख रहे हैं कि चाइना की जो पॉपुलेशन है 1950 में जो चाइना की पॉपुलेशन थी अराउंड 50 बिलियन थी एंड अपवर्ड ट्रेंड में है, बट आफ्टर 2010 अब नाउ इट्स डिक्रीजिंग ट्रेंड है. एंड जापान की पॉपुलेशन है वो अपवर्ड ट्रेंड में, बट इतना जो बर्थ रेट है वो एज कम्पेयर टू जो इंडिया एंड चाइना है बर्थ रेट जो है वो कम है. तो इसका जो ग्रोथ है वो इंडिया और चाइना के कंपैरिजन में उतना ज़्यादा नहीं हो रहा है. In this graph we can see in 2011 population of India was 1.21 billion. Now it is in upward trend and 2036 में we are assuming that population जो है वो 150 मिलियन के करीब हो जाएगी. तो ये अपवर्ड ट्रेंड में है पॉपुलेशन. Decadal growth rate in population to be the lowest since independence. So in 1951 and 61 में जो decadal growth थी वो 21.6 थी and 1961 to 70 2.4 to 24.8 then 24.7. But after 2001 जो ग्रोथ रेट है डिक्रीजिंग ट्रेंड में है एंड 2011-12 में 12.6 थी. तो ग्रोथ रेट हमारी डिक्रीज़ हो रही है, बट अभी पॉपुलेशन जो है वो स्टेबलाइज नहीं है. अभी भी हमारी पॉपुलेशन बढ़ रही है कि जितनी ग्रोथ रेट हमें चाहिए उससे ज़्यादा ग्रोथ रेट है. इनिशियली इन 2010 अर्बन पॉपुलेशन जो डिस्ट्रीब्यूशन था वो 2010 में जो हमारा रूरल पॉपुलेशन थी वो रूरल पॉपुलेशन हमारी ज़्यादा थी, 70% रूरल पॉपुलेशन थी एंड अर्बन पॉपुलेशन अराउंड 31% थी. बट नाउ रूरल पॉपुलेशन डिक्रीजिंग एंड अर्बन पॉपुलेशन इज़ इन इंक्रीजिंग ट्रेंड. तो इसका ड्रॉबैक क्या है कि रूरल पॉपुलेशन हमारी कम हो रही है और अर्बन पॉपुलेशन एज़ कम्पेयर टू रूरल पॉपुलेशन ज़्यादा हो रही है ड्यू टू अर्बनाइजेशन. क्योंकि जो हमारे जो रूरल एरिया है, जो फैक्ट्रीज़ वगैरह बन रहे हैं, तो अर्बनाइजेशन हो रहा है. उसका अर्बनाइजेशन के हमारे हेल्थ पर क्या इफेक्ट आएगा, तो हमारी नॉन कम्युनिकेबल डिजीज़ इंक्रीज़ हो रही हैं. जो हम पहले बात करते थे कि नॉन कम्युनिकेबल डिजीज़ जो है वो अर्बन पॉपुलेशन में ज़्यादा प्रिवलेंट है. बट नाउ इट्स रूरल पॉपुलेशन में, क्योंकि अर्बनाइजेशन बढ़ रहा है, तो रूरल पॉपुलेशन में भी नॉन कम्युनिकेबल डिजीज़ की प्रिवलेंस ज़्यादा हो रही है और कम्युनिकेबल डिजीज़ भी साइमल्टेनियसली बढ़ रही हैं. और अदर जो प्रॉब्लम है की अनएम्प्लॉयमेंट वगैरह, वो भी इसकी वजह से बढ़ रहा है. Population policy in general refers to policies needed to decrease the birth rate and death rate. In 1952, India first country to launch a national program on national population policy. Major emphasis was on reducing birth rate to stabilize the population at a level consistent with the requirement of national economy. In 1976, India first national population policy rule for legal age for marriage from 15 to 18 for boys and from 18 to 21 for girls. In 1976, India first national population policy rule for the legal age for marriage from 15 to 80 for girls and from 18 to 21 for boys. Policy modified in 1977 for importance of small family norm, renamed as National Family Welfare Program. National Population Policy 2000 is more than just a matter of fertility and mortality rates. Women education and empowerment for improved health and nutrition, child health and survival, unmet need for family welfare services, adolescent health and education, and increased participation of men in planned parenthood and collaboration with other NGO. What are the objectives of national population policy? The objectives are introduce and define the national population policy, enumerate the need for population policy in India, enlist the disease of population growth, explain about the objective of National Population Policy 2000 and describe about national socio-demographic goals for 2010, explain the major strategies theme in National Population Policy 2000. What are the causes of high population growth in India? A large population size in reproductive age group, तो approximately 58% population जो इंडिया की है वो reproductive age group में है. And second is higher fertility due to unmet need of contraception and higher desire for fertility due to high infant mortality rate. तो क्या कि हमारे यहाँ इंडिया में infant mortality rate ज़्यादा है, तो उसकी वजह से जो higher desire of fertility है. Then approximately 50% girls marry below age of 18, leading to a typical reproductive pattern of too early, too frequent and too many. And there is preference for male child and more number of children preferred by low socio-economic parents as they need more workforce. There are 3 objectives, 4 new strategy, 12 strategic theme and 14 national social demographic goals and 16 promotional and motivational measures and 150 intervention in National Population Policy of India 2000. There is a need of national population policy since 70s. It was drafted in 1976 and policy statement was also prepared in 1977. Both these statements were tabled in the parliament but were never discussed or adopted. The National Health Policy of 1983 emphasized the need for securing the small family norm through voluntary efforts and moving towards the goal of population stabilization. National Population Policy 1976, what are the objective of this? Increase the age of marriage from 15 to 18 years for girls and 18 to 20 years for the boys, and freeze the population figure at the 1971 level until 2001. Make some portion of central assistance provided to the states dependent upon their performance in family planning. Give greater attention to education of girls and ensure a proper place for population education in the total system of education. Involve all ministry and department of the government in the family planning program, and increase the monetary compensation for sterilization, and institute group award as incentive for various organizations and bodies representing the people at local level, including Jila Parishad and Panchayat Samiti. Encourage intimate association of voluntary organization, particularly the representative women, with implementation of program. Impart more importance to research activity in the field of population control, and use mass media for motivation, particularly in rural area, to increase the acceptance of family planning method. National Population Policy 2001, it is drafted in 1998 and finalized after consultation. It was approved by the cabinet and was examined by the group of ministers. The draft was discussed in the cabinet on 19th November 1999. The suggestions were incorporated and the final draft of National Population Policy was placed before the Parliament. It was adopted by the Government of India on 15 February 2000. The objective of National Population Policy 2000, immediate objectives are to address the unmet need for contraception and health personnel, to provide integrated service delivery for basic reproductive and child health services. Medium term objectives are to bring the total fertility rate to replacement level by 2010 through various implementation of intersectoral operational strategies, and long term objectives is to achieve a stable population by 2045 at a level consistent with the requirement of sustainable social economical growth and development and environmental protection. Major strategy of National Population Policy 2000. फर्स्ट इज डिसेंट्रलाइज प्लानिंग एंड प्रोग्राम इम्प्लीमेंटेशन. तो जो भी हमारा सेंट्रल में जो भी हमारी प्लानिंग हो रही है उसका डिसेंट्रलाइजेशन करना है कि रूट लेवल पे हमारे विलेज लेवल तक वो जो भी हमारा प्रोग्राम है वो इम्प्लीमेंट हो थ्रू हेल्थ केयर पर्सनल्स. सेकेंड इज अवेलेबिलिटी ऑफ सर्विस डिलीवरी एट विलेज लेवल, एम्पावरिंग वुमेन फॉर इम्प्रूव्ड health and nutrition, child survival and child health, meeting the unmet need of family welfare services, diverse healthcare providers and collaboration with the other NGO. Greater emphasis for underserved population group like urban slums, tribal community, adolescent, and increased participation of men in planned parenthood, and involvement of Indian System of Medicine in RCS services like Ayush, and contraceptive technology in research in RCH, and providing health care and support for the older population, and information education communication को strong करना है. What are the national socio-demographic goals for 2010? First is address the unmet need for basic reproduction and child health services, supplies and infrastructure. Make school education up to the age of 14 free and compulsory, and reduce dropouts primary and secondary school level below 20% for both girls and boys, and reduce infant mortality rate to below 30 per 1000 live birth, and reduce maternal mortality ratio to below 100 per 10,000 live birth. Achieve universal immunization of children against all vaccine preventable disease. So there is a mainly 6 vaccine preventable disease. तो उसके अगेंस्ट हम BCG, DPT, मीजल्स, ये जो वैक्सीन प्रिवेंटेबल डिजीज़ है उनमें यूनिवर्सल इम्यूनाइजेशन ऑफ चिल्ड्रन अगेंस्ट ऑल वैक्सीन प्रिवेंटेबल डिजीज़, and promote delayed marriage for girls not either earlier than 18 and preferably after 20 years of age, and achieve 80% in institutional delivery and 100% delivery by trained person. से कि अगर हम क्यों एम्फेसिस कर रहे हैं कि हमारी जो 80% इंस्टीट्यूशनल डिलीवरी होनी चाहिए और 100% डिलीवरी जो है वो ट्रेंड पर्सन से होनी चाहिए, कि उससे बर्थ रेट, डेथ रेट भी कम होगी और इन्फेंट मोर्टिलिटी रेट और डेथ रेट हमारी कम होती है. तो जो डिज़ायर है जो फैमिली प्लानिंग की, तो वो जैसे कि ज़्यादा इन्फेंट मोर्टिलिटी रेट ज़्यादा होती है तो नंबर ऑफ बर्थ भी ज़्यादा होगी. Then achieve universal access to information, counseling and service for fertility regulation and contraception with the basket of choice, and achieve 100% registration of birth, death, marriage and pregnancy. Contain the spread of AIDS and promote greater integration between management of reproductive tract infection and sexually transmitted infection and National AIDS Control Organization. Prevent and control communicable disease. Integrate Indian system of medicine in the provision of reproductive and child health services, and promote small family norm and bring about convergence in implementation of related social sector program to that family welfare become a people centered program. Promotional and motivational measures to order to achieve the objective and goals of the National Population Policy 2000, the following promotional and motivational measures are enumerated. First is Panchayat and Jila Parishad will be rewarded and honored for exemplary performance in the universalization of the family small family norm, achieve reduction in the infant mortality and birth rate, and promoting literacy and completion of primary schooling. Balika Samriddhi Yojana, run by the Department of Women and Child Development to promote survival and care of girl child, will continue. A cash incentive of rupees 500 is awarded at the birth of girl child of birth order 1 or 2, and maternal benefit scheme run by the Department of Rural Development will continue. A cash incentive of the rupees 500 is awarded to mother who have their first child after 19 years of age and for birth of first and second child only. A family welfare linked health insurance plans will be established. A couple below the poverty line who undergo sterilization with not more than 2 living children would become eligible for the health insurance not exceeded rupees 5,000, and personal accident insurance cover for the spouse undergo sterilization. Facility for safe abortion will be strengthened and expanded. Products and services will be made affordable through innovative social marketing scheme, and increased vocational training scheme for girls leading to self-employment will be encouraged. Strict enforcement of Child Marriage Registration Act 1956, strict enforcement of Prenatal Diagnostic Technique Act 1994, and soft loans to ensure mobility to the A&M will be increased. So finally we conclude, population stabilization is a multi-sectoral project requiring constant and effective dialogue among stakeholders and coordination at all levels of the government, society and NGO. and increase literacy, education, especially in female, and availability of affordable reproductive and child health services, convergence of service delivery at village level, participation of women in paid workforce, and male participation in family planning. And success will be achieved if the action plan contained in the NPP 2000 is pursued as a national movement. Thank you.